Hello, my name is Marco Corignac and I'm the president of European Liver Patient Association.
Hi, my name is Pierre Nahon from France and I'm a hepatologist working in Paris, in northern part of Paris, mostly in HCC surveillance and treatment of early stages HCC and running clinical trial there.
So, dear professor, thank you very much. It's really nice to have you here. So what exactly are you doing in your lab and what are you researching?
So my main practice is in the hospital where I set up and run clinical trials in HCC surveillance and treatment of early stages of liver cancer. And because these trials are complex, we also have ancillary studies based on biobanking, based on also environmental questionnaires and everything. So we try to capture the whole spectrum of chronic liver disease and liver cancer early stages, and to provide some information both for researchers and patients and inform on decision on how we should treat them, how we should impact surveillance for liver cancer occurrence.
But you said early stages, so you are working with patients who didn't develop yet. So how do you find the patients that are in early stages?
Yeah, that's a good point, because we have these patients that have a chronic liver disease, advanced chronic liver disease or cirrhosis, and we want to detect liver cancer as soon as possible when it is so small that you can implement curative procedures. So the first step is to deploy surveillance programs in these patients. We have now ultrasound, but we know that it is not sensitive enough for this small lesion. So we're trying to deploy some new methods with biomarkers or some new imaging techniques. And then when you have the small tumors, you can allocate this patient to curative treatment, and you can associate, for example, surgery or percutaneous ablation with immunotherapy in neoadjuvant or adjuvant setting. So this is where we are working in my institution at these different limits between early stage detection and early stage treatment.
So I guess this is hugely important for patients to know where everything is starting, because then you have like several things that you can do. In comparison, if you come to your practice and you have everything already developed.
That's true. The main point here today, as we are speaking, is compliance. If the patient understands why he's undergoing surveillance for many years, or why do we perform a specific therapeutic procedure, then we get an impact on how we can help him fighting the disease. But in the forthcoming years, as we unravel and discover some new, I would say, biological pathways and how to understand how everything works in terms of prediction of the disease, of the prognostication of patients, then we will be able to personalize management and saying you are at high risk of developing liver cancer, so ultrasound is not sensitive enough, you have to go through MRI surveillance. Same goes with treatment. You have a good prognosis tumor, so only surgery, but you have a bad prognosis tumor, so we should also implement immunotherapy before and after. So this is how we are going to personalize these approaches, and the patient is waiting for that.
And in the project GENIAL that we have here today, this is the work that you do also for the project?
This is exactly what we're doing, because we are using cohorts of patients, thousands of patients that have been under surveillance programs for many, many years. So we have biopsy samples, we have radiology, we have genetic data, and we are to combine all this information to have a better prediction, risk stratification of liver cancer implementation. And so in these different HCC risk population, we'll be able to adapt different strategies instead of one strategy fits for all with poor performance exams such as ultrasound, liver ultrasound, but some dedicated population should have also biomarkers, some should have MRI for surveillance, because these are costly procedures and not available everywhere. So we have to decide and be collectively responsible and take into account some complex issues such as cost effectiveness of these new tools for early detection.
So it looks like that your research is not only important just for patients to get the right healthcare path, but also important for physicians to better understand what is happening, and also important for the healthcare community as a whole, healthcare system, because you are like comparing different treatments and you are making the treatment available to the person, not one fits all, but to the person.
Yes, this is true, and this is also true for policymakers, because they have to decide and make crucial decision. Where should we invest money, limited medical resource? For example, if we're talking about MRI, we don't have enough MRI machines. So we have to decide in which population we should use these not available everywhere techniques, whereas some circulating biomarkers may be more available elsewhere, but maybe more costly. And in Europe, this is particularly important because we're trying to provide healthcare for the majority of patients. So we have to decide low risk, high risk, what is the best strategy for each patient.
Dear Professor, thank you very much for today.
Thank you very much.